High blood pressure affects over 1 billion people worldwide, yet often shows no warning signs until major damage occurs. Known medically as hypertension, it quietly strains the heart vessels and organs over years, often without noticeable symptoms. In this film, we journey from arteries to clinics and homes to understand causes, risks, complications, and life-saving prevention. We meet physicians, patients, and families whose lives are shaped by hypertension and examine evidence-based strategies to manage it. Our aim is practical clarity: how blood pressure is measured, what numbers mean, and why early action changes outcomes. Over the next hour, we blend cinematic visuals, expert insight, and patient stories to demystify hypertension and empower viewers. Hypertension arises from complex interactions among genetics, environment, and lifestyle, including salt intake, obesity, and lack of exercise. Age and family history raise risk, while chronic conditions like diabetes and kidney disease compound the danger. Lifestyle factors including smoking, alcohol, excess sodium, and sedentary behavior directly elevate blood pressure over time. Stress and poor sleep alter hormone systems and can produce persistent pressure spikes that drive long-term harm. Certain medications and underlying conditions like thyroid disorders or obstructive sleep apnea may also increase blood pressure. Understanding these drivers helps tailor prevention and treatment for each person rather than relying on one-size-fits-all approaches. Hypertension is often symptomless, yet it damages arteries and organs quietly until a catastrophic event occurs. Left unchecked, high pressure increases risk of heart attack as the heart works harder and coronary vessels narrow. Hypertension is a leading cause of stroke when small vessel damage or clotting reduces blood flow to the brain. Kidney disease follows when persistent pressure scars tiny filters, reducing waste removal and disrupting fluid balance. Over years, uncontrolled hypertension contributes to vision loss, dementia, heart failure, and progressive organ decline. The good news is that timely diagnosis and sustained control dramatically reduce these risks and preserve quality of life. Accurate diagnosis begins with repeated blood pressure measurements at rest, using validated devices both in clinic and at home. Doctors evaluate risk factors, order tests, and may use ambulatory monitors to capture blood pressure over 24 hours. Treatment blends lifestyle change with medications selected to target the individual risk profile and organ health goals. Common drugs include ACE inhibitors, calcium channel blockers, diuretics, and beta blockers, each with distinct actions and benefits. Medication adherence and follow-up monitoring are essential to reach targets and reduce heart attack and stroke risk. For some patients, device-based therapies or specialist care provide additional options when standard treatment is insufficient. Prevention focuses on diet, exercise, sleep, and stress management alongside routine screening and informed medication when needed. Small, sustainable changes like reduced salt, increased potassium, and regular aerobic activity lower pressure substantially over months. Mindfulness, breathing, and social support reduce stress responses that can otherwise provoke pressure spikes throughout the day. Active seniors show that strength training and walking preserve heart and kidney health, improving longevity and daily function. Regular checkups, home monitoring, and open communication with clinicians make long-term control realistic and measurable. With knowledge, commitment, and support, hypertension becomes manageable, enabling fuller, healthier lives for individuals and families. Don't forget to like, share, and subscribe to Health Nova TV for more health awareness and wellness videos.